Hello, good evening, viewers. Welcome to your favorite medical show, Ask Dr. Sawh. Tonight we're back in the studio. Dr. Sawh is back in England, and we still bring the show to you. Thank you for all your contributions so far in the show. It has made it a success. And also to all the viewers who've been sending in your questions, you can continue to send in your questions. Don't be shy. Any question, Dr. Sawh and I will keep it to the highest level of confidentiality, and we are going to answer those questions. We just got 2 questions for later on this afternoon, so our show is just going to be for half an hour today. Dr. Sawh, good evening and welcome.
Good evening, Akash. Thank you very much.
Yeah, how has it been? I know we spoke and you told me you were preparing for a massive graduation for your daughter, Tiana Sawh, Tiana Sawh, Tiana, right? And
yesterday was a graduation. So
I think we have a photograph of it. Robbie, put up the photograph with young Miss Tiana.
So it was quite hectic last night. We had a late night. After that, we had some celebrations.
I can imagine.
So, you know.
Well, the photograph is up here on the screen, and on behalf of all of us here
it's lovely. Yeah, I'm so proud of her. It's a big accomplishment, and she's done really, really well.
So all right, great.
Independent. Dr. Sawh now, so
wow.
Maybe she'll have her own show.
Yes, indeed. Why not? And, on behalf of all of us here at TBN Studios and all the viewers, I would like to say congratulations to Tiana and congratulations to you and her mom. And I must say that Tiana looks so much like her mom.
Yes, no, thanks. No, of course, it's, I'm so happy that, everything went smoothly and, she's all done and dusted now.
Brilliant, yeah. So, Dr. Sawh, this evening we are talking about hernia, and I want to share what I know about hernia. What I know about hernia as a child growing up, as a kid growing up, throughout most of my adulthood also. What I know about hernia is that hernia precedes a goatee. When you get hernia, the next thing for you is goatee. I mean, that's all I knew about hernia. That is, that leads to goatee, and you got to avoid a hernia because every time you think about a hernia, you think that it's if you from time to time, growing up, you will get swelling in the scrotum, and you know that you get worried about it, and they ask, well, if it's a hernia, that can lead to something. And so I always thought that hernia had to do something with the lower part of the body, especially in that that. Oh, yeah. Yes, that where you have the bladder and all of these kind of things, That's what I thought. But if I wanted to ask you, man, I'm sure there is more to hernia than I'm thinking that it's that it precedes goatee. But I want to ask Dr. So what is hernia? And you could say what I'm saying. You heard this, right?
I mean, we heard the term goatee in Guyanese language, but I don't know exactly where it originated from. I mean, if it's a Hindi word or what is that? But I mean, we'll talk about a hernia, and I'll tell you our understanding in Guyanese terms, in terms of, does it lead to goatee, as you say?
Right.
What is a hernia?
Exactly.
So a hernia is a protrusion of content from one anatomical space to another. Mm-hmm. So simply, if you, let's say your body is made up of a wall, like let's say your abdomen. So common hernia would be abdominal hernia. So you have an abdominal wall. And if you look at it from the outside, you have skin. Right. Below the skin, you'll have some fatty tissue. Below that, you'll have a sheath, and then you have muscle. And below that, you have your organs. Let's say your bowel and bladder and kidney and whatever. So if content moves from one section to the next, and there's a deep weakness in that wall, and it protrudes out, so the content moves from one anatomical space to another, that is defined. That's the definition of hernia. So any part of this wall that holds it up, you have content pushing out. So let's say there's a hole in that wall. So let us visualize it, that wall is made up of different sheets, right? Right. And you have one, let's say the muscle is torn. You can't see it from the outside, but what you'll see is something bulging through the muscle. Okay. So let's say the muscle is torn, or even if the skin is torn, and something pushes out of the skin, fat can push out of the skin, that can be considered a hernia. Okay. So really, it is where content pushes out from one part of the body to another part, and it doesn't belong there. Right. So that's the definition. So the hernia is made up of a sac, and you have content in the sac. So the sac is usually that lining that holds the contents, right? So you have that lining that holds the content, and it pushes through that defect in the wall. Now, we know, as you rightly say, that you associate, and lots of people associate hernia only to the groin area.
Right.
But hernia could be lots of places. There are different types of hernia. You could have herniation of the brain.
Okay.
So the brain is in the skull. If the brain pushes out of the skull, so the bottom of the skull, there's an opening, your neck, so there's a hole there. So the brain can push out into that hole. That is called herniation.
Yes.
Brain herniation. But of course, let's keep it simple. Abdominal hernias are the most common hernias around. And abdomen now, it can start from your abdomen below your rib. You can have hernia in the middle here. You call it epigastric hernia. So, that's right up there. As you go down, you can have the belly button. Mm-hmm. That's called a umbilical hernia.
Okay.
Or peri-umbilical hernia. So around the belly button, because that's a weakness. The belly button is a weakened part of the abdomen. So you can have protrusion out there. And as you come down to the groin now, there's a little connection where the blood vessel and the cord that holds the testicle, it connects to the abdomen. So that is a potential weakened space. So you can have protrusion of content from the abdomen into that space. And that is called an inguinal hernia.
Okay.
And as you go down into your groin by your thigh, your inner thigh, and your groin and your inner thigh area, that's called the femoral area, you can have something called a femoral hernia. So anywhere in the body where there's a potential weakness in the anatomy, that is our physical structure, mm-hmm. It can give rise to a hernia. That is content pushes out. And of course, you also have hernia in the stomach. We talked about acid problem in previous episodes, and you have the stomach can ride up into the chest. So it should be in the abdomen, and it rides up into the chest.
Oh, okay.
That's called a hernia as well. That's called an epigastric hernia. Hiatus hernia. Sorry.
Wow.
So there are different herniation and
different types of hernias,
that are called hernia. But by large, about 3/4 of the hernias, 75% of the hernias are inguinoscrotal hernia. Inguinal hernia, that is in the groin. Now come to that term when you say, so you can have a mild protrusion, but that protrusion can also go into the testicle. And I suppose that's what they call Gori.
Right.
In Guyana, mm-hmm. Is it?
Yes, it has to be. I mean, that's a whole nother subject by itself. But when the small, so explain to us, Doc, when the small whatever goes into that scrotum, then how does it elevate to that gigantic?
Big. Correct. So there's an image. Put that image where of the abdomen and where you have
it's up. Yes.
Of the mm-hmm. bowel. It's up.
Yes.
Okay, fine. So you see that connection between the bowel and the scrotum.
Right.
So think about that little hole there. But content of bowel is pushing out there.
Yes.
And think that is a big space. Your abdomen has got lots of bowel content.
Right.
And that whole lot can get into the scrotum. So over time it stretches, and that's how you get at. Now, I suppose testicular swelling, so if your scrotum is swollen, it could be hernia, or there's another condition called hydrocele.
Right.
Where fluid comes out.
Yes.
Where there's fluid into the scrotum. Now that is hydrocele. That's different from a hernia. Mm-hmm. Right? So whichever one is called Gori. I don't know if it's a hydrocele is called that or a hernia. Yeah. But the fact of the matter, I suppose, they say Gori is swelling of the testicle.
And can both lead?
I would imagine.
We're coming off a subject here, but this is interesting because I want to ask: does both lead to the same condition that we call Gori? Can both lead to the same condition?
I don't know what is Gori, but I think Gori is...
Well, the same enlargement of the scrotum, right?
Yeah, but the hydrocele causes enlargement in the scrotum, but the reason for the hydrocele is different.
Okay.
The hydrocele is liquid.
Yes.
Fluid.
Okay.
So inflammation, infection can
Right,
give rise,
right.
injury can cause fluid collection. So that's just collection of fluid. That's not bowel in your testicle. And whereas the one where there's hernia is where the weakness in the wall of the abdomen and lower abdomen, and that protrudes out into the scrotum.
Right. Got
So
you.
they're two different conditions.
Yeah.
But they both give rise to that swelling, testicular inguinal swelling. Now, in the beginning of a hernia, like you will get a bit of a swelling, but when that swelling gets bigger, then it goes straight into the scrotum.
Okay. Now, some of these symptoms are going to be very obvious, very obvious symptoms. But I'm thinking, what other symptoms would you have? Let's say you have a hernia of the internal hernia, as you mentioned. The stomach can protrude upwards into that area,
into the chest.
Right. So I mean, but as I said, when you see the protrusion on any part of your body that's happening, like in your stomach, your abdominal area, there, the lower, the groin area, we will classically could say that's a hernia. But what if it doesn't present with those with that physical symptom?
So I'll tell you, yeah. So the initial presentation would be a swelling. So you see a bulge. So if you stand in front of the mirror and you look your groin, there would be a bulge. So that's a weakness. Or if you're in your abdomen by your belly button bulges out, right? So you would say, fine, that's the weakness. Now, depending on the size of the opening, so let's say you have a small opening, content will go out a little from that small opening like that.
Right.
But if the opening is big, you have a lot more comes out.
Yes.
So depending on the size of the opening, the sac now pushes out. Now, so the signs and symptoms you will get, first of all, initially you'll get a little bit of a swelling. And this swelling goes and comes. So when you strain, anything that put pressure on the abdominal cavity, so you cough, you lift something up, you strain, it increases pressure in the abdomen and it pushes out of that weakness, right? So most people would have hernia where in the beginning it goes and comes. So the hernia pushes out and you can push it out back. Then after a while, it is so big and it gets out, sometimes it gets stuck. The amount that comes out, so the hole could be narrow, bowel pushes out, and it can't go back in, and it gets stuck.
Right.
Now that's a serious condition.
Okay.
If it gets stuck there, then you will have signs of obstruction. So your bowel comes out there, the bowel gets trapped, and it's like you have a twist of
a
the
kink,
bowel.
yeah.
A kink, correct.
Yeah, right.
So if your bowel kink, what happened?
Yeah,
You
can't pass.
stool,
Yeah.
you can't pass wind even. So your bowel gets distended. And that part that gets out, worst case scenario, is the blood supply there can get locked off as well. So if the blood supply get locked off in that little narrowing, and it squeezes the blood off, the bowel below that will rot. As
Right.
Yes, it gets strangulated, we call it,
Yeah.
and it dies.
Right.
So if it dies, it becomes gangrene. Gangrene, dead tissue.
That's right.
So it practically rotten.
And that's fatal then. That's very serious.
Fatal.
Yes.
So it is, people think hernia can be, right, you have a little weakness, a little bulge. No, so you need to deal with it. And I'm not saying that that's a common presentation, but it can happen where you have the narrowing is very tiny, bowel gets in, can't come out back, and you have that strangulation, cut off of the blood supply. Well, the presentation in that case will be more serious. You will vomit, you'll get pains, you can get septic, where infection steps in, you have fever, but you can't miss it because you'll see something pushes out, it's painful, it's red, it's really bad. So that you wouldn't miss. But lots of time you can have hernia where you're not sure, you just have a little bulge. And for us to really feel, so only when you cough you see it or you feel it, and you don't see anything, or you lift heavy weight, it bulges, but when you lie down it goes back because the pressure release is relieved and the hernia pushes in, goes in back. In those cases we may have to do a scan to see the hernia.
Okay.
So you do an ultrasound scan. So, I mean, most hernia, they're obvious, but if you can't see it and patients are complaining, they may have a little bit of a twinge, just a little bit of a pain, and then we scan it to see if there's a hernia there.
Brilliant. You know, Doc, it makes me think also that a lot of young men, you know, they may have some little bit of a hernia and they don't take it serious because they might think that it's embarrassing. You know, they don't want to get it sorted, but then you're basically playing with your life. It can kill you. I mean, you know, as you're saying
yes,
here.
Potentially it can, and I think we are more, the ones that are big and huge, usually they don't get obstructed.
Okay.
Because
right. They got more space to move around. Yes.
They got more space to move around.
Yes.
You got to be careful with the small ones.
Yeah.
You have a little narrowing, a little bulge there, and that gets stuck.
Okay.
So if a hernia comes out and you can push it out back, that's a relief. That's a good thing to do. If it comes out and it gets stuck and it doesn't go in back and you start having those symptoms of obstruction, then you should see a doctor. Yeah, but we should not trivialize it because also it is unsightly. It's an inconvenience.
Yes.
You have something hanging down in your testicle or your groin or your abdomen, your navel, belly button. So you want to wear a short.
Right. Big.
Or a dress
Yeah.
And something bulging. And you can also have, as we talk about the common hernia, you can also have where people have surgery when you have an operation. Let's say you take out your gallbladder. You cut the abdomen. That area can be weakened and you have something called an incisional hernia.
Oh, right.
So any part of the body, you cut your chest and all, you can have an incisional hernia, where you weaken that muscle.
Yes.
And it has an opening and content pushes out.
Okay.
So you can have bowel push out, fatty tissue pushing out, because the covering of the bowel, you have fat, just pure fat.
Right.
Like apron of fat.
Okay.
So all of that, you know, can get pushed out. So depending on, you know, what it is.
All right, good. But let's talk some, you know, investigation and tests. We did mention, you say did some scan, and so you can go with a scan.
Yes.
Are there?
So if somebody,
let's say the one with the brain now. Let's talk about the one with the brain. How do we get that one going? We move from the lower extremity to the top. Yeah.
To the top. The brain herniation, that's a serious medical condition where, let's say you have a head injury, and there is buildup of fluid in the brain, inflammation or bleeding. So what happens if you start to bleed, a blood vessel bursts in the brain, and the pressure, remember the brain has got a small, skull is sealed, and if that pressure increases in the brain, it will push the brain to the side, and wherever there's a opening, it herniates, it bulges out. So the sign for that, you will be critically ill in that case. For you to get a herniation, the pressure would be high, you may be unconscious. Head injury patients, generally we look for those kind of conditions. And then you'll do a scan and you'll see the herniation. MRI, CT scan, whatever you do, well, usually it will be a CT scan. You'll see brain herniation. In abdominal hernia now, any part of the abdomen, you'll see the swelling, you'll do an ultrasound, you can see it. CT scan, if you're not sure, is there something more going on with the bowel? A CT scan is more effective or can show more information with bowel than ultrasound. Ultrasound will show you that there's a defect in the wall, and it will identify the hernia. But let's say you have complicated hernia where the bowel is obstructed and is twisted and things like that, then a CT scan would probably be a better investigation for that. Obviously, because the treatment of hernia would be surgical in most cases, you may want to do blood tests to ensure that this patient doesn't have sickle cell, this patient blood count is good, you want to make sure the kidney function is good. These are the little basic tests you can do before when you're preparing them, fine, I need to treat this patient is going to go for surgery.
All right, good. Let's talk about some treatment then. You know, how do you treat?
So the basic principle of hernia management would be surgery is really the end of it all in terms of how do you fix a hernia is a surgical remedy. If someone were to say, well, doc, I don't really want surgery. I mean, we see people protruding the navel, belly button pushing out. They have a swelling here, or the groin, they have a small swelling. What you can do initially, you can wear corset. So anything to hold up that. So belt, when you exercise, patients sometimes wear abdominal belt.
Right.
Those things prevent hernia because you support in the abdomen. If the abdomen, so as you get older, sometimes the muscle gets weaker. So hernia also can happen as you get older. If you're obese and the wall of the muscle is weak, fatty tissue get into the muscle, weaken the muscle. If you don't exercise, if you strain, these are the causes, right? How you get that. And we don't know exactly. There are some patients who are born with hernia. So babies in the developmental stage or in the birth state, defect, you're born with a congenital hernia, where that part of the abdomen did not grow well. You can have hernia from that. But the management would usually be surgical. As I say, lifestyle, initially, you don't want to lose some weight, you don't want to prevent things to increase pressure in the abdomen, and you can wear corset in the beginning, but eventually it would be surgery. So what the surgery entails, you will open, now in the old days, they used to do open surgery, where they cut it,
right, and
push back the content, and strengthen the sheet. So you put mesh. There's some material you can use where you reinforce the wall.
Okay.
So wherever the weakness is, you reinforce it, and you close that hole. You know, as I said, you have a little opening in the wall of the abdomen. You want to close that. So it's a surgical approach. But now we do lots of laparoscopic surgery, keyhole surgery. So you don't have to have that big open surgery. You can have a little keyhole surgery and fix the hernia. But yeah, that's your management, really. Very straightforward. So I will say to patients, if anyone has got hernia and they feel it's troublesome, see the doctor, get it treated. Lots of time I tell patients, like, they would say, fine, doc, it's not bothering me, and I wouldn't do anything with it. But if you travel a lot, let's say God forbid, you're in a country where there isn't healthcare readily available, and you get an obstructed hernia, that can be an issue.
That's right, yeah.
So I would advise, like in the UK here, patients will come and say, doc, I don't really need to treat this hernia. If anything happens, I'll go to a accident and emergency. Well, yes, you can do that, but that's an emergency. That's a different thing. When you prepare for a hernia surgery, it should be smooth and straightforward. But if you go in as an emergency patient, when the hernia is obstructed, it can become a bit more problematic. You know, the bowel you may have to take away a piece of the bowel.
Right,
because the bowel gets trapped. So these are things, you know, you advise patient on.
Well, thank you so much for this, for explaining this in such a way that we can all understand it this evening, because you know, hernia it's more serious than I even thought. But what I've gone through my questions for this evening, so we're going to finish a little early this evening, but I got two questions from last week, and remember, viewers, you can continue to send in your questions. All right. Last week we were talking about the question was about blood pressure, and this person said, "Doc, what is meant by your BP is optional? That is what my BP machine is telling me."
Well, not optional, optimal. It should be optimal rather than optional.
Oh, right.
If your BP is optimal, it means it is where you want it to be.
Okay.
It's optimal, it's good. So if the machine, probably, I don't know for that viewer, probably the machine it will tell you normal, optimal, or low or high. So the machine will beep sometime when it's high, or it tell you out of range. So depending on how the machine is calibrated, but I think what they meant there is that your BP is optimal.
Optimal, not optional. All right, great. So, viewer, I hope you got that from Dr. Sawh. And I got one more question here. Doc, does sex make your pressure go normal?
Good. That's a hard question. I don't know. It depends on how much work you're doing.
Okay.
So, and how relieved you are, maybe before or after.
Okay.
How much stress or no stress is involved. No, I mean, it's a difficult question in the sense that, I don't know the answer. But I would imagine if you're exerting yourself in a way where your heart rate is going up, blood pressure is a function of heart rate and cardiac output. So the heart has a capacity, it squeezes blood. So if it has lots of blood in it, it squeezes the blood out, that sends the pressure up. And if they squeeze fast, the pressure goes up. So if your heart rate increases, then your blood pressure should go up.
Right.
That's logical theory. So I would imagine if you're having sex and your heart rate goes up, your pressure should be a little bit up. But our body has controlling mechanism.
Okay.
Where your body has a way of controlling. Your pressure is not going to be so excessively high that it will cause a problem. There are drugs, for instance, also blood. For you to get an erection, blood flows into the penis. Patients who are taking drugs, for instance, their pressure can drop. Like if you take nitrates, the blood that you put for heart, it causes your blood vessel to dilate, as in expand, and that can drop your blood pressure as well.
Just to add, Doc, this question came from a female also, right? So I think that what she's saying is, let's say you're suffering from low blood pressure or high blood pressure, if having sex can actually normalize it. I think that's what she's asking.
If you, if you're in the process, probably your blood pressure will go up a little. But yes, if less stress, let's say that makes you happy and you're less stressed. Of course, stress is a cause of high blood pressure.
Absolutely, yes.
So,
yeah, that's what I thought too.
Don't read too much into that.
Yeah, all right, no. Yeah, so if he was here, thank you so much. I mean, your questions mean a lot to us, and Dr. Sawh is always here to answer those questions and to give you insights into his life as a medical professional through what he's presenting here and his experience. So, Dr. Sawh, this evening, what would you like to say in closing?
Again, thanks to your team, yourself and your team, and to the viewers. Thanks for tuning in. And I know today has been a short topic. I mean, I'm still reeling from last night.
we give me a little break. We can give you a little break.
I didn't want to like cancel the program.
Right. Yeah, I really appreciate that. Yeah, we appreciate it.
And so I said, okay, let's talk on a small topic today. So that's why I said hernia is a good one.
Brilliant. And from all of us at TBN Studios and all of us on this show, let Tiana know that we send our congrats and our love to her too. We wish her the very, very best in the future. Carry that Sawh name carry it greatly, with integrity and honor. It's a good name because you're doing a great job, Doc. You're doing a great job. So viewers, thank you so much for joining us tonight. It has been a pleasure having Dr. Sawh here again this evening. We're going to be back next week, and just remember to send in your questions. Even if you're not joining us tonight, you're watching the show any other time after, you can still send your question in, and we're going to have them answered next week. So have a wonderful weekend, everybody. A wonderful week, everybody. Stay safe and stay healthy. All right. So have a good night.